Hi, doctors. Thanks for taking the time to talk.
Hi.
Hi there.
So, I heard the COVID-19 vaccine is now available in the NWT for 5 to 11-year-olds?
It is.
Yeah, you bet.
Why do children need the COVID-19 vaccine? Do they even get seriously ill from COVID?
Children under 12 now represent one of the largest unvaccinated groups, which means that they are currently among the most vulnerable to catch the virus. While we know that children do not necessarily have the same risk of serious illness and death that us adults have, COVID in kids can still result in hospitalization, death, and long-term consequences such as long COVID and multisystem inflammatory syndrome, also known as MIS-C. MIS-C is a serious complication of COVID in children and causes inflammation of organs such as the heart, lungs, and brain. Getting our kids vaccinated means not only protecting them from the infection, but also means protecting our families and communities. It represents a large step towards getting life back to normal. And for kids, this means freedom to participate in school and activities that they love.
Yeah, kids have been through a lot in the last 2 years.
Honestly, they really have. As a mother and a doctor, I've seen firsthand how COVID has disrupted children's lives. Kids have had to learn from home, constantly be in isolation, and had their social lives upended. It's not fair to them. A huge amount of research and testing has been done on these vaccines, and we know that it is safe and effective for children. The COVID-19 vaccine will help families return to normal.
What if my child is not easy around needles?
As a nurse practitioner and a longtime northerner, I've traveled across the NWT working at vaccination clinics, and we always want to make sure it's as easy as possible for you and your child. If your child has disability or phobias or is nervous, we have many options to help make it a positive experience, such as going into a quiet room or wearing noise-canceling headphones. At the end of the day, having you hold or encourage your child and prepare them ahead of time on what to expect can really go a long way to helping your child have a good experience.
Are there any health risks when it comes to children getting the COVID-19 vaccine?
The risk of complications from COVID itself is actually a much bigger threat than side effects from the vaccine, most of which are mild. More serious side effects that you may have heard about, such as myocarditis, are extremely rare in children. When myocarditis does occur, it is usually very mild and easily treatable with over-the-counter medication. The risk of myocarditis from COVID itself is much more likely to occur than from the vaccine.
What about the side effects from the needle itself?
The worst you'll probably see is your child may have a sore arm, feel tired, have a wee headache, or be feverish for a day or two, but that's about it. These are normal side effects when receiving any vaccine.
And remember that your child could still pick up COVID from somebody even after getting the COVID-19 vaccine. However, if your child is already protected by the vaccine, they would typically just present with a simple cold.
It is normal to be protective when it comes to your family. I mean, this is all so new to everyone.
Absolutely, and no one will ever blame you for asking questions, especially when it comes to your children. I just want you to know that we're here to help you. If you have any concerns about the COVID vaccine for children, contact your local health center.
They're here to answer any questions.
And to help keep you and your family safe and healthy.